Hello and welcome to the National Indigenous Radio Service's weekly news and review. I'm Adam Evans. Each week we take a look at the issues making headlines in our communities, but I'd like to begin by acknowledging the elders of the land, past and present. In recent weeks there has been confusion at a federal level on advice around what vaccine to get to better protect yourself against COVID-19. When the Delta strain hit Australia, Prime Minister Scott Morrison declared the AstraZeneca vaccine available to all adults if they want it. In April, the Australian Technical Advisory Group on Immunisation, the body responsible for advising the government, declared the AstraZeneca vaccine unsuitable for adults under 50 years of age following reports of rare blood clots. ATAGI revised that decision in June, saying the AstraZeneca vaccine should be given to adults 60 and over. Dr. Jason Agostino is a medical advisor for the National Community Controlled Health Organisation. He says people under 60 should get the Pfizer vaccine. However, if it's unavailable, you can talk to your doctor to get the AstraZeneca.
Well, it hasn't quite gone to the start that we'd want, and I think that's not news to anyone. But I think it's really important to reinforce that all Aboriginal and Torres Strait Islander people 16 years and over are eligible to get a vaccine now, and we're doing a lot of work to make sure that both types of vaccines are available within Aboriginal medical services across the country, and also in other GPs. So up until now, there's only been AstraZeneca within clinics, and that's the vaccine predominantly for people over the age of 60. And unfortunately, most Aboriginal and Torres Strait Islander people are under the age of 60. More than 90% are under the age of 60. So, and they've had to go to Pfizer which hasn't been around. But in the last few weeks, we've been getting more and more Pfizer into communities and into health services in the cities. So we're hoping to get more and more Pfizer out there and into people's arms as soon as possible.
As you mentioned, AstraZeneca is for over 60s. I guess a lot of our listeners or and other people out there would be sort of seeing this disagreement between the Prime Minister and the mob that give the advice, I guess, the doctors there. What do you sort of make of that, and what should people be listening to?
Yeah, look, the main source of advice in Australia is ATAGI, which is the Australian Technical Advisory Group on Immunisation, and they've always said that, it's changed, but the advice is that for people under the age of 60, that Pfizer is the preferred vaccine. But there always has been the thing that if people don't have access to Pfizer and they want to discuss with a doctor about potentially having AstraZeneca, even though they're under the age of 60, they can. So that's still there, and many people have had AstraZeneca because Pfizer isn't available. But the advice remains that for people under the age of 60, that Pfizer is the preferred vaccine. There has been a lot of confusion about when to get a second dose. I didn't really talk about that. So, that again, the ATAGI made some pretty clear advice yesterday about when to get your second dose. So for people that are in outbreak regions, so people in Greater Sydney, if it's been more than 4 weeks since your first dose, they're recommending everyone come in now to organise to get a second dose. But for people that are outside places where there is an outbreak, it remains that waiting 12 weeks after your first dose of AstraZeneca is the recommendation. So that's been something that's been a little bit confusing.
I'm assuming that remote rollout would be a bit slower than the cities, yeah? Is there, I guess, more we have to do there?
Look, I think the good thing with the remote rollout is that we're sort of tackling it from lots of different ways. So we're getting some doses into our Aboriginal Community Controlled Health Services out there through the Australian government supply. In some cases, the state or territory government has been doing some supporting rollout into remote communities, and also the Royal Flying Doctors Service has been going into some areas as well. So we're tackling it from multiple different avenues. That said, you're right that the coverage of people that have had at least one dose of the vaccine is lower in remote regions, but we are seeing over the past few weeks that has been